Around the world, diabetes is on the rise. 1 adult in 11 now has diabetes, and this number is growing fast. The risk of getting diabetes increases if people don't eat healthy food or don't get enough physical activity.
Based on the data from the International Diabetes Federations, the number of diabetes sufferers in Indonesia will reach around 19 million people in 2021. The number has increased significantly 70 times compared to 2010. The World Health Organization stated that there has been an increase in the death ratio to diabetes in adulthood from 8th position in 2010 to 6th position in 2019. In Indonesian context, the risk factor for diabetes occur due to genetic or family history factors, low physical activity, unhealthy eating patterns, smoking behavior, low level of education are related to knowledge about health or health literacy. Type 2 diabetes patients are patients with low level of medication adherence. Low compliance is often the cause of therapy failure, so that the risk of complication is higher and can affect the patient's quality of life. Things that can improve treatment compliance and manage the quality of life of sufferers, good and comprehensive health service will provide a sense of comfort and trust to the patients, especially if it is supported by an information system and a clear and direct treatment flow. For this reason, innovation is needed that can provide warnings for taking medications and self-care that is integrated with hospital therapy for diabetes patients.
As we know, we are currently entering an era of digitalization, where almost all activities are shifting into technology-centered approach. In Indonesia, every healthcare facility should apply the online medical record system, or we can call it by ambulatory medical record or EMR. Based on the previous research, digital health application can increase a person obedience that to lead a better health condition compared to the direct visit method. DiAlert will be the beneficial for this management of type 2 diabetes. The government of Indonesia currently implement a policy in the health sector to use only one application to integrate individual data as one of the efforts of the health transformation. This application is expected to collaborate with every healthcare facilities or specialist doctor that close to the type 2 diabetes management. This is how it works. Patients don't have to download a specific application, but this feature will be automatically activated in the healthcare application as long as they have completed filling the data profile. When the doctor has input the examination data and therapy into the EMR, the alarm feature will read the therapy and it will be saved automatically. So it will look like this. They are patient name and then the healthcare facilities name that the patient received the treatment, and then the doctor's name and the doses of the medication. The alert notification will appear automatically and ring when it is time to take medicine or it has take time the routine control. Then it will stop ringing if the user scans the barcode of the prescription. In further development with this feature, we will include socio-cultural aspects as a social support in order to increase patient treatment innovation or motivation.
The health belief model can be a usable framework to understand factors influencing behavior related to managing type 2 diabetes. Healthcare professionals can leverage the health belief model to design intervention that can promote to increase self-management and medication continuously in people with type 2 diabetes. Let's see the points. First, increase perceived susceptibility. It's important to inform patients that if they don't effectively manage their type 2 diabetes and receive low treatment rates, they could face more serious consequences. Second, emphasize perceived benefits. DiAlert has the potential to improve self-efficacy in their ability to effectively use technology to enhance self-care and adhere to their medication regimen. Third, provide clear calls to action. Aware of the advantage, individuals are likely to feel more compelled to utilize DiAlert, facilitating regular evaluation of the medication monitoring. Furthermore, it is expected to have a positive impact on the patient adherence to self-management practice. Elderly individuals might experience discomfort when using smartphones or might lack the technical proficiency required to effectively navigate mobile applications. Alarm notification might not be noticeable for users with hearing impairments, leading to missed reminders.
To integrate this solution into overall type 2 diabetes management, we will seamlessly link patient medical records with the alarm system for real-time updates and personalized care. When a doctor updates a prescription in the AMR, the alarm system should automatically create reminders for the patient to take their medication as prescribed. There will be comprehensive management features such as blood glucose monitoring, diet and exercise logging, and appointment reminders. We will work closely with doctors, nurses, and diabetes educators to ensure the system meets clinical needs and support patient care effectively. As administrator and provider of DiAlert, we can control the statistical movement of users so we can calculate the total of DiAlert users. Also, it will show us some hospital graphics that are connected to this DiAlert as the center of monitoring. As time goes by, we have to maintain and make this program sustain. We need to collaborate with NGO, health community, and government. Although we realize it would not be instant, but we have to go through the process step by step and our goals, and it needs at least 3 years to develop this program and marketing.
This program will be nothing without planning and budgeting. In 2024, we will focus on market analysis. We predict it will be end in the first quarter of 2025 because we should know what people need for the diabetes mellitus type 2 treatment management. This is important because why do we develop a platform if the community doesn't need it? On the other hand, we formulate the prototype and do a trial in the first quarter of 2025 as soon as the market analysis is done. We really hope this timeline could run well as we planned. Next, we will conduct hearings and demonstrations to several targets who might become our working partners, such as hospital organizations, professional organizations, and internet organizations. We hope it could be done in the middle of 2025. Then, in the third quarter, we could launch our product to the community with our partners. And at the end of 2025, we will do an evaluation because we want to know how many people have used the platform and obviously what things should be repaired and updated. And our next movement in 2026, we focus on expanding our targets, both the community and the partners. Also in that year, we will try to approach the government because we have a dream that our platform could help the government implement the health system in this country. And maybe could be launched globally, we hope. And of course, we will do another evaluation to make sure our movement and platform can achieve our target as we planned, especially to help the treatment management of diabetes mellitus type 2.